Hi friends, welcome. I'm glad you're here with me today. My name is Amy Rose White, and I am a pregnancy and postpartum and perinatal mental health expert. And I'm here today to talk to you about non-medication or natural, otherwise known as complementary or even alternative, treatments for anxiety and depression during pregnancy and in the postpartum window. And beyond, actually. Everything I'm going to be talking about today are actually evidence-based treatments for anxiety and depression at any time of life, but they are particularly important for those who are dealing with mental health complications around the birth of a child. So, medical disclaimer. Anything I talk about today, please talk to your care provider, your APRN, your nurse, midwife, your OB, your PCP, anyone who prescribes you any other kind of medication. Be sure and check in with them, especially if you're pregnant or nursing or chest feeding a baby. Given that, what's really important to know is that if you're considering alternatives to medication, it's probably because you've either been on medication for anxiety and depression before, or someone's told you that you ought to be, and you're considering and weighing the pros and cons. So the first thing I want to say is I am not anti-medication. I've been a psychotherapist for many, many years, been a mom for many years as well, and I've also am a survivor of depression and anxiety and PTSD. And I am a big believer in medication when it works and when that fits with your value system and when your body needs it and if it works for your body. The reality is there's a lot of misinformation out there around whether medication is safe during pregnancy and nursing, and the truth is it is. There are one or two drugs on the market, period, for any condition that you absolutely cannot take because of the safety to the fetus, either during pregnancy or to the newborn baby in the postpartum window. Virtually everything is considered safe, and you should also know that the benefits of taking the medication have been very clearly demonstrated in the literature to outweigh the risks of exposing the child to the illness. So I really want you to hear that. Not treating your depression or anxiety well, whatever that means, it may or may not include medication for you, especially if you catch it early. That is actually more dangerous. It appears to have more long and short-term effects on the growing baby and developing children once they're outside, including older children in the family, believe it or not, than does the risk of exposing a child in utero or through breast milk to a small amount of medication. That is very, very clear in the literature. Not all providers are aware of that, but it is absolutely true. So that said, talk to your doctor about what I discussed with you today, and know that medication is a very safe treatment in terms of the child for depression and anxiety. That said, sometimes it just doesn't work for certain people. And some folks like me, I had been earlier in my life on and off a bunch of antidepressants, and it's not a super fun roller coaster if you don't hone in on the one that works for you immediately. So that said, that's kind of how I got into the world of integrative mental health care and understanding more about nutrition and hormones and the impact of those elements on mental health, as well as the world of amino acid therapy. So today I'm just going to talk about 3 over-the-counter options for naturally treating anxiety and depression. And amino acids are natural in the sense that they are naturally occurring substances, amino acids, that are the precursors in our brain to really important neurotransmitters, which is just a fancy word of saying mood chemicals in the brain. And I'm going to talk about the top 3 that are my favorite and what they are, their dosages typically, how to use them, and why. So the first is called 5-HTP. Again, you're going to see this down in the link underneath this video for more details on how to spell things and where to find more information. So be sure and check that out. But 5-HTP is the precursor to serotonin. Serotonin is the primary mood chemical that a lot of the antidepressants will give you, like Prozac, Lexapro, Zoloft, Celexa. Those are really popular ones. Even Paxil, although that's not prescribed very often anymore. They will provide more serotonin to your brain with a different way of getting it there. In mental health and medicine, we call this mechanism of action. So the mechanism of action in the prescription drugs is really different than taking amino acids, but the result is basically the same. And in the literature, 5-HTP very well treats mild to moderate depression or anxiety. That's one major benefit it has. Promotes sleep, because a lot of you are having a hard time falling asleep and staying asleep, and weight loss, which can be a nice side effect, depending. So 5-HTP, unlike the prescriptions, has a little bit of a lower side effect profile. That's why I like the amino acids as a strategy, possibly a first-line strategy. And it tends to work relatively quickly. So folks will see a difference a little bit sooner than some of the prescription drugs. Now, the downside is that 5-HTP and the other two I'm going to talk about today have not been well studied during pregnancy and lactation, like all the psychotropic drugs. That's how we know that they're fairly safe. So your doctor is more likely to recommend that you take Zoloft or Lexapro, especially Zoloft, because it appears to get to the baby in the lowest levels during pregnancy and during nursing. But it's not always the best fit for people. But that's why doctors will prescribe medication first, is we've just studied it more. We understand the short and long-term effects on babies more than we have the amino acids, because frankly, no big pharmaceutical company owns the amino acids. There's tons of different companies. You can walk down to Whole Foods and just get them, or your local natural food store. So there's not a lot of money to be had. That's my philosophy on why we don't have better data around pregnancy and nursing. However, a lot of functional medicine providers, family nurse practitioners, naturopaths, chiropractors with prescribing privileges, they feel that the amino acid family is just as safe as the psychotropics. But that is a cost-benefit analysis that you need to make based on doing your own research and evaluating what your own beliefs are and what makes sense. You can also call your local pregnancy risk line, and there's going to be some medication resources at the bottom of this video as well, so that you can make an informed choice. And my desire in making this video today is simply to offer you a little more information in terms of your choices around treating anxiety and depression that may include medication, but can also include some nutritional supports, or what I call brain support. And really, it's kind of different language for the same thing. It's about getting the chemicals in your brain balanced so that you feel well and like yourself again. So back to 5-HTP. Serotonin is one of those primary mood chemicals. We get it when we go running. We get it after we've eaten certain foods. We get it when we have a loving embrace with someone that we care about. Serotonin is really important. So number 5, HTP, is usually started in a dosage of around 50 milligrams for 5 days, 7 days, and then you go up 50 milligrams or so until you notice that you're feeling more like yourself. The dosage range is quite wide, usually anywhere from 50 to 600 milligrams. Again, that's going to be totally individual and dependent on you, and it's important to start low and go slow, because your brain might require a tiny, tiny bit, and that person over there, their brain requires a lot more. And it's all just based on how their brain and body metabolizes supplements and medication. And you kind of don't know that till you get started trying something. Okay, so number 2, the second one, is called SAMe. It's just like it sounds, like your buddy Sam - letter E, SAMe. It stands for a really long, complicated word that I'm not going to try to pronounce right now. But SAMe is a naturally occurring molecule that, and here's the big benefit of SAMe, it provides 3 neurochemicals. So it promotes serotonin production, but also dopamine and norepinephrine. And dopamine, again, you get from various activities and street drugs. That's one reason why a lot of people who are suffering from depression or anxiety will be drawn to street drugs, because they temporarily increase dopamine production, and then unfortunately it crashes, leading to feeling even worse than before, which then can lead into a vicious cycle of addiction, actually. And then norepinephrine gives us energy. It's like it sounds, epinephrine. If you've ever gotten lidocaine for your teeth. There's some epinephrine in there. If you've ever been in a car accident, all of a sudden you have adrenaline and norepinephrine surges through your body. So for folks with a lot of sadness, a lot of fatigue, SAMe would be my first go-to even before 5-HTP. 5-HTP, by the way, is also really helpful for anxious thinking and racing thoughts and even sort of obsessive compulsive thinking where you kind of are ruminating over and over again. So it depends on what is your primary symptom, but especially if you have a lot of fatigue, SAMe can be really wonderful. It outsells Prozac in Italy where it is typically manufactured. It is that effective. And for SAMe, the dosage usually starts at around 100 milligrams and can go all the way up to 1,600. Around, I think, 8 to 1,200 has been studied in men specifically. I've seen people do well on less. I've seen people do really well in the very upper range, depending on how their brain works. So SAMe is a wonderful thing to consider. Number 3, and last for today, specific to anxiety, and if you want immediate effects that you're going to notice, instead of using a benzodiazepine like Ativan or Xanax or Klonopin, which are all potentially addictive and have some side effects, particularly they can be sedating. They're not all equally sedating, those 3, but when you're having to run after kids or wake up in the middle of the night to feed a baby, sometimes the benzodiazepines can be problematic. They can also be life-saving, especially if you take them for very short term while you're waiting for an antidepressant or anti-anxiety medication to start working. But that said, a lot of people want to avoid the side effects and avoid the risk of dependence. So L-Theanine works really well in that regard. And typical dosages start at 50 milligrams to 200, although they can go as high as 800. L-Theanine actually comes from green tea. It's an amino acid found in green tea, and it increases the production of GABA in the brain, which then leads to serotonin and norepinephrine and dopamine. So it's kind of like SAMe, but it works in a different way. And within the hour of taking it, you usually notice a calming, relaxing feeling, which can be really helpful if you're someone who deals with panic attacks or agitated anxiety, or there's something particular, maybe like leaving the house with your kids or going to a social event is really anxiety provoking for you. L-Theanine can be very helpful and work quickly as well as in the long term to help balance out all those wonderful mood chemicals that get, fancy mental health word here, dysregulated after pregnancy or during pregnancy and then after having a baby. So I hope that this has been helpful. These things that we're talking about today don't encourage dependence, and that's one of the reasons that I like them. They're, again, to summarize, their low side effect profile and the fact that they work relatively quickly means that they're really important options to consider when you are formulating with your care providers your own wellness plan for recovery around pregnancy and postpartum emotional health reactions. I hope you've enjoyed this. Thank you so much for being here with me today. I wish you all well. May you be safe, may you be happy, may you be at peace. Until next time, bye.